We were prepared for HIV/AIDS, any kind of calamities that would be linked to HIV/AIDS. I think we would have been able to handle, because we went through many coups d'etat, many political issues. The year before, we had 4 successive hurricanes, flooding, insecurity. So we were armed. All our patients get an extra 2-week supply of medicine, the basic medicines, because crisis in Haiti rarely lasts beyond 1 week. So if we give them 2 weeks, they are okay. So we knew that our patients had enough drugs for 2 weeks. That give us some time to prepare during this 2 weeks period. Now, we were faced with 3 new challenges that we were not at all prepared for. One was the thousands of wounded people who were coming to our place for help. The second challenge we had, which I must say was the hardest, was the fact that we had over 7,000 people who came to our campus for help. They had nothing. They had lost everything. And we had to provide for everything. The third challenge was tuberculosis. The only laboratory that could do the basic diagnostic test that you do in developed countries. And it was in a building that has been compromised. And in it also we had dangerous strains of tuberculosis in tubes that were broken. So that had to be decontaminated. And we had to set up 2 new labs for the diagnosis of those patients. At the same time, an acute field hospital, the only one that exists in the capital, to round up all TB patients out of the hospitals and put there. With the help of the government and the president himself was involved, we obtained a state land that we prepared for about 2 months. We put gravels, we drained the place, and we've been able to move them from the flooded area in our campus to that facility. But there you will see the tents are lined. Sanitation is well organized. We have water on one side, latrines on the other, and we have a daily census of the population to ask about 4 major signs and symptoms. Do you have fever? Do you have a cough? Do you have diarrhea? Do you have a skin rash? Anybody who has any of those signs and symptoms is seen by a dedicated team. This way we've been able to prevent acute epidemics and control that from the start. So we are already planning the next move, which will be putting our displaced population into sites that have been defined by the government and in habitats that are decent in terms of size and also in terms of construction.